Good morning, it's Coach Ricky Burke. Oftentimes I get asked what we do in Mobility Sundays. Today I'm going to break down the difference between doing myofascial release with a traditional foam roller and a lacrosse ball. Typically, depending on the area that you're trying to break down, whether it's like scapula, pecs, calves, anything really, it's really just about density and surface area. That's usually why a lot of higher level athletes or experienced weightlifters usually gravitate a little more towards a lacrosse ball because it mimics more of like that elbow or the hand feel, like a deep tissue massage, and it's just a little more specific and targeted. So usually what a lot of people do when they foam roll their back is they kind of just get really apprehensive and they hug themselves. They kind of just stay in this position, which is totally fine. But what I like to do is, especially when you're on one of those tight tender spots, is press and hold. If you're using a roller especially, you can afford to kind of stay on the actual scapula. It's soft enough to where it's not going to necessarily hurt or cause any damage. Then from there, I usually like to bring my arm into all these different ranges of motion. I usually say I'm arms on the clock, and I try to hit every time in the hour. So I'm basically just kind of moving my arm around. Every time I move my arm around, the scapula like rotates forward or depresses, upward rotation, retraction. And what the foam roller does is, while you're going through all those different ranges of motion, while you're basically getting a self-massage, is in theory, it helps break down more tissue and pump more lactic acid out of sore muscles, help with recovery more, and the works. So that's good for the general population. Now, if you're a hardcore weightlifter, athlete, you're somebody who maybe works a lot, gets a lot of tight, dense knots, lacrosse ball is probably what you're gonna wanna use. I usually say avoid bone, stay on soft tissue as much as you can. Now, of course, if you hit bone, it's not the end of the world. Just obviously try to not aim for bone here. And then from the scapula, right, let's imagine this is like a wing. We want to go from almost like the top portion here all the way to like the middle of the back and hit every little nook and cranny that you can while you're going through that extension and flexion here. Now I've been doing this for probably 7 years now, before and after my shoulder reconstruction surgery. And man, this has helped so much with mobility, soreness, tension in the neck and traps. That's more of the upper posterior chain, right, pertaining to the shoulder blades, but you can also pin this against the rig, get up in your traps. I'll save that for another video. Since I'm already here, I'll show you how to use it for your pecs and your chest. So kind of similar. If the lacrosse ball is just too much, I usually tell people to use the corner of the foam roller, right here. Not like any of this stuff, just right there. Just for surface area sake, it just gets a little deeper and it's not as hard as a lacrosse ball. And then from here, it's kind of a similar concept. Just left, right. If you can go internal, external, cool, you're just hit more angles of all this different dense tissue that tends to be in the pecs and shoulders. I usually, if you can, add a little scorpion. That way it just adds a little more pressure while we kind of roll and massage out some of that tissue of the pecs and chest. A lot of times that doesn't really do the trick, and that's usually what the lacrosse ball is for. So I usually try to avoid where the actual joint insertion is itself. And I usually try to stay right on the actual pec and anterior delt. Try to not stay like right on the joint. And then same thing, I try to hit as many different ranges of motion as I can. Now granted, I've been doing this a little bit. Now granted, it doesn't feel super comfortable, but especially at first, it's gonna feel really uncomfortable. So brace yourself, breathe. It's very normal to sweat when you do myofascial release, especially on yourself. It's a little deeper. You're not as nice as those massage therapists at the Grotto or Happy Head or wherever else you guys go. But boom, boom, all these different ranges of motions, more for the shoulder. And I pretty much do the same thing when it's on the pec. If I want to hit a little scorpion to add a little flare and extra pressure, that's always an option too. Now, usually that's the Cliff Notes version. I'd be a little more thorough as far as the exact placement, but you guys get the gist of at least the difference and why you would use these different myofascial release tools. Also, this is just one facet of the mobility aspect, right? That's why massage therapists exist. That's why stretch labs exist. That's why gyms exist. And that's why physical therapists exist, right? You have to hit kind of every spectrum when it comes to mobility, stability, strength. And this is really step one as far as creating mobility for yourself to build a foundation to get stronger off of. So that's at least the gist of this video as far as myofascial release, but definitely try to add and build on to that. And that's at least a little bit of what we cover in Mobility Sundays at North County Fitness. So if you have any questions, comments, concerns, hit up the gym, hit me up, slide a DM, and let's get mobile.